Welcome back to Nurses Insiders, where we make complex medical concepts easy to understand. Today, we're diving into the human respiratory system, its anatomy, and its essential functions. Whether you're studying for the NCLEX or just brushing up on your knowledge, this video is for you. Let's start with the basics. The human respiratory system is responsible for taking in oxygen and expelling carbon dioxide. The process is vital for cellular respiration, where our cells produce the energy needed for daily activities. The respiratory system can be divided into two main parts, the upper respiratory tract and the lower respiratory tract. 1. Upper respiratory tract, nose and nasal cavity, the primary entry point for air. The nasal cavity warms, moistens, and filters the air. Pharynx, a muscular tube that serves both respiratory and digestive functions. It has three parts, the nasopharynx, oropharynx, and laryngopharynx. Larynx. Also known as the voice box, it contains the vocal cords and is crucial for speech. The epiglottis here ensures food and air go into the right channels. 2. Lower respiratory tract, trachea. A rigid tube that connects the larynx to the bronchi. It's lined with cilia that trap and expel particles. Bronchi and bronchioles. The trachea divides into two primary bronchi, one for each lung. These further branch into smaller bronchioles, leading to alveoli, lungs, the main organs of the respiratory system. Each lung houses millions of alveoli where gas exchange occurs, alveoli. Tiny air sacs surrounded by capillaries, they are the site of oxygen and carbon dioxide exchange. The process of breathing or ventilation consists of two phases, inspiration and expiration. 1. Inspiration-inhalation. The diaphragm contracts and moves downward, increasing the thoracic cavity's volume. The external intercostal muscles contract, lifting the rib cage. This decrease in pressure inside the lungs allows air to flow in. 2. Expiration-exhalation. The diaphragm relaxes and moves upward, decreasing the thoracic cavity's volume. The internal intercostal muscles contract, lowering the rib cage. This increase in pressure inside the lungs forces air out. Gas exchange process. Gas exchange occurs in the alveoli. Here's a step-by-step look at this critical process. 1. Oxygen diffusion. Oxygen in the inhaled air diffuses across the alveolar membrane into the surrounding capillaries. It binds to hemoglobin in red blood cells and is transported throughout the body. 2. Carbon dioxide removal. Carbon dioxide, a waste product of cellular metabolism, diffuses from the blood into the alveoli. It is then expelled from the body during exhalation. Regulation of breathing is regulated by the respiratory center in the brainstem, which consists of the medulla oblongata and the pons. 1. Medulla oblongata. It controls the rhythm and depth of breathing. It responds to changes in blood pH and carbon dioxide levels. 2. Pons. It helps regulate the rate of breathing. It ensures smooth transitions between inhalation and exhalation. Protective mechanisms. The respiratory system has several protective mechanisms to prevent infections and injuries. 1. Cilia and mucus. The respiratory tract is lined with cilia and mucus to trap and expel particles and pathogens. 2. Cough reflex, a sudden forceful exhalation to clear the airways of irritants. 3. Sneezing, a protective reflex to expel foreign particles from the nasal cavity. Common respiratory conditions understanding. Common respiratory conditions is crucial for nurses. Here are a few. 1. Asthma, a chronic condition where the airways become inflamed and narrow, causing difficulty in breathing. 2. Chronic obstructive pulmonary disease or COPD, a group of diseases including emphysema and chronic bronchitis that cause airflow blockage and breathing problems. 3. Pneumonia, an infection that inflames the air sacs in one or both lungs which may fill with fluid. 4. Pulmonary embolism, a blockage in one of the pulmonary arteries in the lungs, usually caused by blood clots that travel from the legs. Importance of respiratory health. Maintaining respiratory health is vital. Here are some tips. Avoid smoking. Smoking is a major cause of respiratory diseases. Regular exercise helps improve lung capacity and overall health. Healthy diet. A balanced diet supports immune function and overall health. Vaccinations. Staying up to date with vaccines like the flu shot can prevent respiratory infections. That wraps up our overview of the human respiratory system. Understanding how it works and how to maintain its health is essential for every nurse. If you found this video helpful, make sure to like, subscribe, and hit the notification bell for more educational content. Thanks for watching Nurses Insiders, and we'll see you next time. Disclosure: this video is intended for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have seen or heard in this video.